is what are the challenges that one faces during internship? So
basically, according to me, internship itself is a challenge. So according to me, it's a kind of the process of refining our knowledge of whatever we have studied all the 4.5 years into practicality. So I think there can be different types of challenges. Like firstly, intellectual challenge. So it actually makes us realize how much we have studied, how much we have learned, and how much we actually know to apply in the clinic. And then there comes this physical challenge where we are too much tired all the time, like due to 24-hour shifts or 36-hour shifts. We're always tired, and that's how we need to roam around the whole hospital, getting investigations done, finding the doctors, getting opinions done. So that's very tiring physically. And then when it comes to social change, so there's sudden change of routine, there is sudden change of people around you, there is sudden change of the people with whom you have to communicate. So that is one thing. And mentally, it is very tiresome. It is a challenge when you have to, actually attend rounds, present cases to the consultants, and remember each thing about every patient in the world. That's I think that's the biggest challenge that anyone can face just after entering internship.
Right. Dr. Deepti, what is your take on this? No, you're not audible. You're still on mute. 1 second. Yeah, I think you can unmute now.
Yeah, I fully agree with whatever Anuradha has said, that it is mentally, physically, and socially completely challenging. I think for me personally, I found that not having a routine was very challenging for me, because throughout MBBS, every year we have a set curriculum. This is what you are supposed to learn, and it's very organized. In internship, you don't learn in an organized manner. You learn through your sense organs. You watch and learn, and it's not like a very structured environment to learn. You have to put in effort from your side to learn. I think that was a little challenging for me. And secondly, I think the fact that I didn't have control over my day, as in I wouldn't decide the hours, I wouldn't know when to come back. It's very you're not prepared how it progresses, because it's totally in someone else's control. You cannot predict what will come. I think that was a little challenging for me. And thirdly, I think interacting with so many seniors and not getting overwhelmed by the amount of brilliance that you're surrounded by in terms of postgraduates, senior residents, professors. It's a lot of social interaction that happens there, and it's a little overwhelming in the beginning, I would say.
Right. So, I've seen most of you all, come back very tired, and, all of you want sleep at the end of the day. So how do you deal with burnouts? What is this burnout exactly, and how do you all deal with it? Dr. Anuradha first, yeah.
So you can see me, even now I'm back from a 24-hour shift, PG. I am from a college where there were no PGs till last month. So we interns were everything under SR. So we had to do all the board work, write all case sheets, present cases in front of consultants, write on whatever advice they're telling and execute it, and learn amidst all this, learn all the skills amidst all this. So it was very hectic for us, especially for major subjects like medicine, surgery, and OBG. But the point is, at the end of the day, you have the satisfaction after you finish your duty. If it's a duty day, you have the satisfaction that you've learned so much. You have learned to, for example, perform a arterial blood gas analysis. You have learned fluid tapping. You have given a spinal anesthesia successfully. It's all very much satisfying, and that's how I think that boosts me up whenever I'm tired, and that's how I get up and go work the next day.
Right. Dr. Deepti?
Okay. I think burnouts happen when you try to push yourself beyond what is physically capable for your body. And in the medical community, it's very common, because if you hear someone say, okay, I did a 24-hour shift, immediately someone else will come and say, that's nothing, I did a 36-hour shift. It's like we are competing to be more burnt out. And that toxic atmosphere itself is a first step to identifying that you're burnt out. And I personally felt that I was very tired during my major postings like surgery and OBG. Once I got into my minor postings, I used that time to kind of regroup and recuperate and get back to work. And also the fact that at the end of the day, you have, like she said, you have a lot of satisfaction in putting into practice what you've been doing for the past 4 years. Because entering the hospital as an intern is so much different compared to entering the hospital as a final year student or a third year student. It's a totally different experience, and that's one thing. And I really like kids. So whenever I'm in the hospital, if I see a kid, I try to talk to them, and that kind of helps me put things into perspective just talking to them. And one more thing I incorporated in my routine was that during a 24-hour shift, I would not think a lot about this. I have to be here for 24 hours. I would just think about it as I have to be here for the next 1 hour, and this is what I'm going to do. Just breaking it down into smaller steps, that helped me a lot. And sometimes even if I was in the hospital, I would try to mentally dissociate from there for at least 5-10 minutes and just try to be in a space where I was alone and I could relax for at least 5 minutes. And that kind of throughout the day, if you give yourself those 5 minutes break once in a while, you can keep your sanity intact, I feel.
That's pretty valuable piece of advice both of you have given us here. Right. So moving on to the next question, what are the skill sets that we're supposed to acquire during internship?
If I have to answer it, I think the most important skill that we have to acquire is the skill of communication, talking to patients. So that's the first thing. Then it comes to smaller things like loading drugs. You have to learn to load drugs too, because you never know, you don't have a nurse at hand. Then you have to learn all the IV fluid administration techniques. What happens when it gets blocked, what to do, how to flush it. Then you have to learn Foley's catheterization, right tube insertion, cannula insertion, and then drawing blood for blood samples for tests. These are the basic things that you have to learn. And then when it comes to particular subjects like medicine, you have to learn how to do ECG, how to do an EBG, correct an EBG sample, ascitic tapping, fluid tapping, CPR, and at the last, intubation too. Sometimes we have done many intubations. So, and when it comes to surgery, dressing, different types of dressing. You have to learn to be very good at dressing, because it's very important in patient care. And then suturing, obviously everybody enjoys suturing. Then assisting in OP, it is a very good thing if you actually get hands-on experience from your seniors. Then when it comes to anesthesia, giving a spinal anesthesia, you have to get opportunities to give as many spinals as you can, so that you can actually find out structures which you're piercing through. Then you have to learn the OT etiquette, like what happens in an OT, how they maintain sterility, how they actually do it. So that's very important when it comes to anesthesia. And in ENT, like minors like ENT, syringing to remove bags, of course, impacted bags, and like foreign body removals, very simple ones, not complicated ones. They wouldn't allow us to do it because we could again complicate the things further. When it comes to OBG, it's very enjoyable. Like you kind of normal labors, you go assist cesarean sections. You do many small, but very important procedures. Like many, they can lead to complications like ARM, artificial rupture membranes. Then you do gel induction, you do Foley's induction. Then you do something like copper insertions, or you can do spark smears. You can do, you can try to do some rapid antigen tests for HIV and for COVID, whichever is followed already. So in Ophtha, you have to learn vision testing, and I was lucky enough to give a peribulbar block for cataract surgery. Then fundoscopy, you have to learn doing fundoscopy. Casualty, you have to learn all the emergency techniques, like how to assess atrial bleeding and circulation, how to stabilize it, etc. Then in pediatrics, newborn resuscitation is very important. You have to learn pediatric cannulation, drawing blood from a baby, and feeding through nasogastric tube, making sure that the babies don't aspirate whatever they eat. Then when it comes to orthopedics, applying slabs and casts, it's the first thing. And you can try your hands on reduction of fractures, sometimes in casualty. PSM, You just have to understand the grassroots level. I think this is what the skill set that I think has to be learned in internship.
That's a very broad set of skills that we have to acquire in a period of 1 year. Right. What is your take on this, Dr. Deepti?
Covered almost all the departments that we go to so well, and it was nice listening to her talk because I could go through whatever posting I've been there and think whether I have done this or not. It was really nice. And I would just like to add that if you're choosing your minor posting during internship, just be mindful of what you're choosing, like whether you're choosing psychiatry, dermatology. Choose a subject that you have a confusion whether you want to take it up for PG or not, because working there you'll understand whether you can actually do it or you'll rule it out. That's one thing. And I think in internship, the apart from the things that you have to learn in each posting, what I felt was universal for all posting was that you should be mindfully doing things, because as an intern we're doing a lot of things that the sisters also do. What differentiates us from them is we should be thinking while doing anything, not simply passively the motions just because someone's told us. And I feel that it's obviously going to help in entrance, but it's going to help in practice as well, because every time I would enter the OT, instead of simply changing and getting that, I would think which part of the OT zone am I in, like, just thinking, like, it makes the whole experience like a game. When you try to question yourself every minute of the day, you keep yourself on your toes. So when I change, I'm like, which part of the OT zone am I in? And whenever I see an oxygen cylinder being pushed, I consciously tell myself this is a black cylinder with a white top, things like that. Every time you insert a Foley's and you see the colors, ask yourself what it is, and just making the whole process very game-like. I enjoyed that the most, instead of simply doing things because someone else has told that. And also, like, while giving spinal, I would mentally tell the structures being pierced, like skin subcutaneous. I would do that, and I feel like it stayed with me longer because of obviously the repetition that happens, the number of times you do things. And secondly, you're physically present and using all your sense organs to learn instead of just memorizing. I felt that that's what made my internship very fun for me.
Right. So to sum up, we have to focus on the communication part of it, a lot of skill sets to work on, and to be mindful. I mean, question ourselves as to, what are we doing? Why are we doing it? And keep learning each moment of what we're doing.
Because internship is not like final year. Nobody's behind your back always with an exam to study. You have to set yourself questions and you have to set yourself deadlines, what you want to learn in each posting. And I felt that the college, of course, gives a curriculum, what are the skills you have to learn in each posting. I felt that beginning of each posting, if I made a list of what I have to study and what I have to learn, and at the end of the posting, if I tick everything off from my list, it was a productive posting. I felt that.
Right. That brings me to the next question, which is, what is the difference? How is it, going to be different for an intern at a government college and an intern at a private college? This is something many people have asked me, and I'm putting forth the same question across.
I don't know. I think I'll let her answer that first.
Dr. Deepti?
Okay, I have worked in a private hospital, Ramaya Medical College, and I experienced to be very good, especially because what I had heard was that in private colleges you don't get a lot of chances. But I think my batch got really lucky because the first year PGs weren't there. Right. So we basically got a lot of chances because the first year PGs came so late. So I felt that the workload was definitely more, but the chances that we got in surgery or I because there was no PG at the first year level to take that work. That's one. And I felt that being in a private college, I got to see a lot of rare cases. And I really enjoyed that part of my posting, like understanding certain syndromes that we have just seen in the textbook and we would have never thought that we'll see it in real life. And to actually see that, it was a for me. And I think a little bit of exposure to super specialty and everything happens here, like through pediatric surgery and the references that we get from multiple super specialty branches, and just going So as an intern, if you're in a particular department and you need a reference from a super specialty branch, you will end up communicating with them as well. So I think just being in contact with so many of people from different branches, that experience was good in a private college. And I can't speak for government college, she has to tell.
Yeah, that's very well put out. Is there anything else you'd like to add, Dr. Anuradha?
So for me, I think in government college, it's ample opportunities. So I think you're just learning to insert the candida. Once you try it fails, you can always go and take the other one and insert it. Like you don't have to pay for it by yourself. That's one advantage. Another thing is, yeah, we don't have in our hospital, especially wherever I have completed my internship, we don't have super specialty. We don't have neurosurgeons or we don't have cardiologists. And we don't have MRI in our hospital for that matter. We just have a CT scan, plain and contrast. So whatever I think is that we usually try to diagnose by clinical methods. That's very important for a doctor at the beginning. We directly don't go and jump to the investigation. We start with the clinical methods, try and eliminate the costlier investigations that we can ask the patient to get done from outside, so that we can focus on one thing that can give us the diagnosis. That's the thing that I think in government college. And yeah, we have seen many cases of the same thing. So that once, like for example, you take moon phase. Moon phase comes in so many things. It comes in CKD, it comes in CND, it comes in Cushing's, so many things. Hypothyroidism, moon phase happens. So whenever you see a patient entering the casualty or entering the OPD with the moon phase, you already have a diagnosis in the mind. That's how we are exposed to many types of cases many times in a day or in the year. So I think that's an advantage in government college. And yeah, and not having PGs, not having a senior batch, not having all three types of PGs was a big advantage to me, because we had to go and communicate with the consultants. We had to go do all the word work, write all the case sheets, and that's how I think we really got a very good experience in our college. Uh, and I don't think I just because I'm not seeing how it works in a private college, I can't judge what's the actual difference.
That's why both of you are sharing the experience.
I can works in college.
Sorry, your voice broke.
That's okay. That's continue.
Okay. Yeah. Another thing is that during internship, I've heard that there's a lot of hardships one faces, and one of the most important and hard things being that you have to deal with the loss of a patient. So, have you had such an experience, and what has that taught you? How have you dealt with it?
Yeah, many times actually. Every day in casualty, all the end stage organ failure patients, they actually die in casualty. That does not actually scare us much or surprise us much, because they are already in the end stage and we can expect them to expire, because they cannot afford something like chronic liver disease patient cannot afford a liver transplant in the lower economic section. So we are bound to believe that he needs to go into hepatic encephalopathy if he does not comply with the treatment, and he will die of it. So that does not actually scare us, but some cases when we do not expect the patient to deteriorate, those actually scare us a little. And maybe we can reflect about what investigations we had to do extra, what we had to suspect when the patient came in, which would actually help us get the treatment better for her. Once we had a case like a young 25-year-old lady came with complaints of vomiting, just vomiting, and epigastric burning sensation. We thought it to be just gastritis because of some wrong food that she ate, and we just treated her symptomatically and sent back. And after a few hours, we can see the same patient coming back to the casualty with no cardia, no heart sounds. So such kinds of cases actually scared me, and I was totally blank for one day after I lost that patient. Yeah, that happens, but yeah, we have to move on. That's how things work.
That's actually a pretty hard thing to go through at the start.
Yeah, like we do not know what we are doing, because we were the only people, in terms of the only people in the casualty to see the case, and we felt that we are somehow responsible for her death, or we could not help her. So that actually scared me. But in the end, when we talk to our seniors, they tell us so many things. Talk to the consultants, they tell us so many instances where such things have happened and what may be the actual cause of which you might have taken some poison or anything. Then we hadn't taken the proper history, thinking that it's just vomiting. So that is it. I think that helps. Talking to seniors, they will convince us, they will console us, and we can move on from that information. And the point is, an intern should not declare that alone in the casualty or in the wards or anywhere. He or she has to have a consultant before he or she declares that. That is a very big thing to declare that. That's right.
Right. Right. Thank you. Dr. Deepti?
I dealing with death, especially in casualty, you save lives, declare death. It's two opposite ends of the same spectrum, and you go through all these emotions in one 12-hour shift. Once you save a life, you're elated to a certain extent, and suddenly it comes crashing down when someone dies. And part of the training I have realized is not just studying or being good at the theory aspect of it, or even the skill aspect of it. The emotional aspect of how with death, how to communicate such sensitive issues to patients. That's all a part of the training. So I've we've had a patient. I felt that I was more depressed when I saw a patient who was brought dead, because there was absolutely nothing we can do except register a flat ECG and inform. And that was one of the most challenging. Like, you're paralyzed and your hands are tied because everything happened before you've come to the scene, and now somehow you're supposed to inform them about things that have happened when you weren't there. That was a little challenging. And like, watching postgraduates do what they do, and understanding, watching and learning from consultants how well they communicate such sensitive issues to family members, all of that, I think that really helped me understand that medicine is not a science of knowledge alone. It's a science which involves a lot of emotions, and understanding that is really important.
I particularly asked this question because I had a senior who I think was doing her surgery rotation at that time, and she had seen 7 deaths in a span of 1 week. It was one after another, and she was quite apprehensive to just enter the wards or OT after that. She did come out of it, but I was wondering, what would I do if I were in such a scenario? How do people handle it? So that is why I put it across today.
There are few interns who kind of feel very overwhelmed by this. Very normal to feel overwhelmed. Like, I think you need a lot of support from your co-interns, from your superiors, to handle such things, because you're so new at it. We are the baby doctors in the hospital. Like, so I need a lot of support in sensitive times like this. And another thing I'd like, day in and out, it really puts life into perspective. Because most of the time we are always running around collecting investigations, skipping food, and the 5 minutes of time we get in between, we are on our phones solving questions. Once you see someone die right in front of you, you understand whatever you're doing is important, but also take a step back and think whether all this worry is necessary. Your life into perspective, because we are always chasing something or the other, and once you see someone in a flash just like that, it puts things into perspective.
That's right.
Yeah, once in my medicine rotation, during the day casualty, we had 6 deaths just in the day casualty from 8 a.m. to 8 p.m. We had 6 deaths that day, and all the time, and also many complicated cases. Everything was a cerebrovascular accident or a MI or anything, and hepatic encephalopathy. So many people died that day. Like 6 deaths from medicine, 3 deaths from surgery. It was very hard on us to actually digest that there are so many deaths in the casualty just in the day shift. What about the night shift? So that happens, but yeah, at the end you know that it is what you have to see the whole life as a doctor. When you cannot help it, you just cannot do anything.
And even it's very overwhelming when you see mass casualties and you have to triage and decide who gets what resource first. That is also very overwhelming, because you have you have to make a decision in a split second. So triaging for mass casualties is very hard, and I think that's a little hard for us.
So the main takeaway from here would be that, I mean, you have to accept it as a part and parcel of the whole course, and also communicate to people whenever we feel low about this thing.
Yeah, especially the babies. That's of babies in the ICU, neonatal ICU. It's very hard to digest. Just a day ago, the babies are so cute, and the next day you have to, hand over the dead body to the parents. Or so, in tears. That's very thing. That was one part where I felt very much overwhelmed that a baby is such a small, cute baby is dying. I think more than others.
That would indeed be really, really heartbreaking. So moving on to the next question, I've heard a lot of people tell that, after final year, that's probably the last they got to open their books through and through. And many people keep asking me this, like how are we going to prepare for PG along with internship? So that's why I'm putting across this next question. That is, do you people actually get time to, open the textbooks and read it and prepare for PG? And part two of this question would be that a lot of us are actually confused about what area to specialize in. So how do you make a decision on that? Yeah, that's the question.
Should I answer that first?
Yeah, Dr. Anuradha, you can take it.
Yeah. Okay, I think we can have time in the minor postings like ENT, ophthalmology, dermatology, casualty duty. It's a bit tough, but yeah, and others like orthopedics a bit. But in the major postings, I think there was no time at all for me to come back and study. More than not having time, I was so tired that couldn't afford to open the book and study. So whatever I did was I prepared myself that I am not going to think about studying when I'm in the medicine or surgery postings. I'm going to stay as much as possible in the casualty, be it 3 hours extra or 4 hours extra after my shift, and I'm going to learn how much about clinical skills I can. I saw I used to stay for a long time in the hospital, even after my duty ends, so that I see many cases that are getting admitted and learn from there if I cannot open textbooks. And but during the minor postings, I felt that I have to enjoy a bit also and make memories, and so I stick to myself from studying. It's not that we can't study; it's just that I didn't study a lot. I just studied a little.
Right. And did you like make a decision on what you would like to do? What you like to specialize in?
I'm excited to know what she has decided because she's so well in the department. Now I'm really curious to know what she would like to do.
So I think the PG that actually suits anyone is a branch where they do not get exhausted at all. So where they're not at all tired of working how many hours it is. And for me, I think it was general medicine and OBG. OBG second, but general medicine was the first. I would rather go and sit in the casualty for whole 24 hours and see cases if my body permits, if my mind permits. And I love general medicine. I think that's all. So whoever has to choose PG branch, I think wherever you enjoy the most, that's what you have to take. Wherever wait for the postings to end, I think you should not ask the branch. That's it. That's what I think.
That's very beautifully put across, Dr. Deepti.
Yeah. So I feel that you get yeah. Can you hear me?
Yeah, I can hear you.
I think you get enough time during minor postings to prepare. I consciously didn't make an effort to study because I was focusing on some other aspects of my life, like writing a book or my Instagram, stuff like that. I was sure that I'll take a gap year because I had to finish writing the book this year. So I used my internship time to solve questions instead of studying. So my approach was synchronous studying and asynchronous solving, which is whatever procedure I see and which department I'm in, synchronous to that, I would read the related to that, just that's it. Solving is asynchronous completely, which is a subject which is not at all related to where I am, so that there's a freshness to when I'm studying. That's what I did. And yeah, like I gamified the whole experience again because I would love solving numbers. Like I would love finishing a particular number of Q banks each day. So I like that. And for a period of 2 months or 3 months, I just didn't study during surgery because I was so overwhelmed and exhausted during surgery and OBG. But other postings, you get enough time to study if you want to. And if you are sure that you will take a gap year, it's good to have a clear perspective about what you want, because internship is different for everyone. In final year, everyone is working towards the same goal, which is clearing final year. But in internship, someone's here just for attendance, someone's here just for clinical skills, someone's here for NEET PG, someone's here for PLAB, someone's here for USMLE, someone's preparing for UPSC. It's everyone has a different approach, and you just cannot compare yourself to others. So at the beginning of internship, if you sit down and take 5 minutes to jot down what is the path that you would like to follow for the next year and whether you will take a gap year or not, depending on that, you can use your time. I use my time during breakfast and all to solve a little bit. Like whenever, so whatever I'm saying is on good days. Obviously, I've had bad days where I didn't want to open any question. On a good day, you can use your time, and don't set unrealistic expectations that you have to study every day, because every day is not a good day to study. Some days when you are really in the mood to study, a bank on that and kind of try to take advantage of your good moods, I would say. So I would try to trick my brain into studying by studying what topics I like early in the morning. So at the end of the day, I felt that I didn't have control emotions, because I would come back exhausted, tired. Sometimes you get yelled at by the consultant or PG or whatever. If that affects your morale so much. So I thought the only time of the day where I have full control over myself is in the mornings. So I would finish whatever part, little bit of studying in the morning, and throughout the day, whatever happens, I was already happy. Like, chalo, whatever happens, I have done my thing in the morning. So even if I get scolded, whatever happens, I'm like, my day is going well, because in the mornings it happened. And I learned this very late that because I would just come back from the hospital and wonder, why do I not want to study? And that's when it hit me that I don't have complete control of my emotions at the end of the day. So much later in internship, after 6 or 8 months, I realized that. So in the evenings, I would just come and work on my Instagram page or something like that.
Right, both of
I
you.
think that's what happened with me too. At the start of internship, I just decided. I just tried to study at the start. I started with PSM, which actually left me with a lot of time. But when I started studying, I realized that I had to make memories with friends too. All the 4.5 years, I've just studied, and now it's time. I think after 1 year, we're not going to meet each other. I decided that I'm not going to stress myself out on studying. Instead, I would concentrate on my health or my extracurricular activities that I'm actually into, and yeah, making memories with people, making memories with the city, that with the hospital, with the nursing staff, everything. I gave that more importance than actually preparing for PG, because I knew I need a drop year later. I need to rest for some time, and I need to study without any other thoughts in mind, any other negative thoughts in mind, or any other disturbances. So that's how I decided, and it depends. Many people actually prefer to study. Like if you if you do not get chances or opportunities in the hospital, it leaves you disheartened, and you will go to study. So you will go and you will think that no, I have to study, I have to get a PG seat so that I also can do such things. Such people actually, they go towards studying. And whenever there is less stress, you just have to collect investigations, or you just have to make sure everything is done, consent is taken, all that, or the smaller things, it's okay. You will have time, you will not be stressed mentally. But if you have to do everything like writing the case sheet, presenting the cases, getting in everything done, and communicating to the patient relatives, to the nursing staff, it's a bit tedious, which leaves us with no energy at all at the end of the day. That's what happened with me.
Both of you.
I agree with the whole aspect that when in the beginning of the year only, if you decide that you're going to take a gap year, you plan your preparation and your internship really well. That even in the beginning of my internship, I had decided that I will also take a gap year. So it was easier for me to handle the whole internship drama, because no added stress that I have to get a seat this year.
Right. That's like very vital points that both of you have shared and beautifully put it across. I believe both of you are like, coming to an end of the internship. Is there any memorable, experience? I mean, internship is filled with a lot of stories, a lot of experiences. Is there anything in particular which would have changed your perspective or has brought a lot of joy? Anything like that, a specific experience, Dr. Anuradha?
There's many actually. I cannot tell one or two instances. And even if I tell, they would mean very small to you and very big to me and to people. Because you think, oh, it's just a diagnosis, it's just a right diagnosis that she had done. Many people do a right diagnosis. But I think the first diagnosis, the right diagnosis, independently of any intern, is the best memory. I actually don't remember which was my first right diagnosis, but every time I did a diagnosis and it turned out to be right. For example, if it's a CDA case, you have to write the name of the diagnosis for that on the neurological, anatomical, pathological, etiological. When you get all the four things correct, even before the consultant is coming to the rounds, you have assessed the patient clearly. You have gotten all the investigations done. You have put the treatment chart by yourself. You have, if it's a hypertensive urgency, you have settled the hypertension. The patient is now stable. The patient is now ready for further, investigations, evaluation. That's how, that's what actually was the most beautiful memory of my internship. Even during surgery, if you have sutured it wound very nicely, especially on the face, there's a lot of cosmetic, importance. So especially if it's near the eye, and your suture may actually, pull the lower eyelid down, and it may cause an ectropyon later. And you've actually taken the finest and thinnest of the suture and sutured it very like intricately, so that it does not cause any kind of tension in the whole face, and it heals very properly without a scar. That is actually something that was a very beautiful memory for me in my surgery, in my medicine. And OBG is the first independent delivery that you conduct, the normal labor. Everybody has this beautiful memory. And when the patients in the hospital, they remember you. Like many times, the patients come back with many diseases. If it's, like immunocompromised, they come back with so many diseases again and again. Even if you are in a different department at that point of time, they would recognize you, come and show the reports to you and take advice from you. That's what is a real success. That's what is a very beautiful memory to any doctor, I think.
Especially the OBG one. I know a lot of us, a lot of people, a lot of my friends, seniors, they all end up putting up pictures of the very first, delivery that they've done independently. Dr. Deepti?
Yeah, I like most of my internship. I was happy with the new experiences that I was having, and I liked the first time I scrubbed in that. The first surgery, it was lap chole. So before the surgeon came in, I was with the anesthetist, and he was just casually asking me, classify anesthetics, tell me types of barbiturates and stuff like that, and what is the antidote for benzodiazepine stuff. Very basic pharma questions he was asking, and it was something that everyone would obviously know. And what is a dissociative anesthesia, stuff like that. And at the end of it, he let me intubate on my very first case. So that the whole, it's such a life-saving procedure, intubation. If you get the intubation right and you see the capnographic waveforms, that's truly beautiful than that. And that was one thing that I really liked, because, and that same surgery I scrubbed it, I sutured as well. So the consultant surgeon was like, the beginning and the end today is by the intern. She intubated and she sutured. So it was a really memorable experience. And I genuinely love talking to kids in the hospital, and I have some of the best memories of my internship with mostly kids, because, and I use humor to cope up with whatever's happening in my life. So once I was in the casualty, and this 5-year-old, I think 7-year-old boy is there, and we're just chatting, and he tells me everything about his friends, about his neighborhood and everything. And then I ask him, what do you want to be when you grow up? And he says Enoilla, which is nothing. He just doesn't want to be anything when he grows up. And I found that so heartwarming. I really like talking to kids, and I found a lot of interesting answers that kids give to what you want to be when you grow up. So that's my standard question to ask kids these days. And what's your favorite color? So stuff like that I really like.
I think Pete's ward is altogether another experience. I
Yeah.
personally find it very therapeutic more than anything else, especially talking to them and playing to them, even during the postings alone.
It's when the children are stable, you know. If
Yeah.
you are in a pediatric ICU, it's a hell because you know what happens in the government hospital, in our hospital, the children have removed their oxygen masks. There are no probes connected. Everything is disconnected. There are wires, and on those wires the children are sleeping, and even the parents are sleeping on those wires. And you have to go every time to each bed, take those wires out, connect the probe, connect the, put the oxygen mask on, check the vitals of the baby, is it going to apnea or anything, and come back. I think the most horrible thing. That's why I really wanted pediatrics to end because it was such a tough job to do it. And children, you never know. One time there's something, and the next second, some you never know what happens to them. Even in the SNCU, you have to be constantly taking a look about all the babies because you cannot differentiate seizures or conversions in babies very easily. There is jitteriness, which is very much similar to convergence. So even a cry, even if a baby is excessively crying, you have to go and check whether it is converging. So that's a very hard part of pediatric. Except that if the babies are very stable, it's too much fun. And if it's an ICU, it's dreadful.
And coming to a couple of the last few questions that I'd like to ask. So the end of internship, I mean, like, has the whole process brought about a change in how you see yourself?
Is she talking, or can I take it?
You go first. You go first.
You can take it up.
Okay, so I think till final year, most of us, or at least me, I was mostly concerned with getting marks or getting a particular rank. Once you become an intern, you realize that literally nobody cares what your marks are. And that is such a huge, huge learning. So if there's any final year students watching this, I just want to tell you that nobody cares about your final year marks. I've been an intern for 11 years now, and not one person has asked me my final year marks, unless they already know it and they want time, but nobody cares. And you could be a repeater, you could have taken a 10-year gap, it doesn't matter if you're an equally. And I really like that change of atmosphere from a classroom environment. That was one thing that I think changed in me as a person, that I started looking at medicine as not just diseases and illness, but as people, because now you're interacting with people, not just with your textbooks. I felt that.
That's super vital, actually. Dr. Anuradha?
Yeah, that's actually very nicely put because you never know who is going to perform how in the internship. A person whom you had thought was not actually too much interested in academics or wouldn't study a lot, wouldn't score a lot, would come to the hospital and work with such presence of mind that you would be astonished. Oh my God, even I should work like him for her. So that happens. You see people change very much in the in internship days. And yeah, well, if I look at myself, I think I've become more confident after my internship. I think I have the ability to at least have a small thought about any case that comes to me. Any patient coming to me with any kind of complaint, I think I can have a small thought and maybe a list of differential diagnosis I can put up, especially in the major postings, in the postings which I've actually enjoyed. So that's how I think we have become more confident about the internship. And the point that we should understand is that studying is totally different from working. When you go into the hospital, you actually learn how things are. It is not as simple as you have studied in the textbook, or maybe it is too simple and it was complicated in the textbook. And there is a very famous saying that what the mind wants, the eyes see whatever the mind wants. But probably sometimes what happens is first you see it, and then the mind realizes, okay, so this must be it. So first you see some symptom in the patient. Oh my God, this is happening, this is happening. Then you connect the dots, and then you realize that okay, this is the diagnosis. This is what is happening to the patient. So that I think it goes hand in hand, whatever you see and whatever you're being. So at the end of internship, we all come out very confident to at least make some of the diagnosis give proper treatment, or at least decide what is happening to the patient and where the patient needs to be referred if the patient cannot get a care. I think that must be the aim of each and every intern, to understand what is happening, to understand the root cause, to refer the patient to a proper specialist to get proper treatment. That is what everybody should be. So this is the summary.
I also feel that at the end of internship, you develop instinctive gut feeling, which days, but over the course of the year, you develop, you pick up on signs and symptoms that are very common, and you have a gut feeling even before, just by their attitude, their gait, the way they are sitting. Because I'm currently in ENT, and just by the third day, if anyone, even if I don't examine the ear and there's a patient who is old, who is on steroids, and there's a fluctuating diabetic course, you will think about malignant otitis externa without even examining the ear. This instinctive gut feeling, I think you'll develop over the time without even realizing that you're consciously developing it. You'll just be present in the ward, listening, learning, and one day suddenly, instinctively, these answers come to you. Because that physical presence in the wards is very important to develop this gut feeling.
I totally agree with that.
Share it really beautifully. My last question to both of you would be that, how do you handle criticism that you come across, or say you've had a bad day, you've made some errors? How do you handle that?
Many a time, I think we have had such bad days. We have had people telling so much to us. We have had consultants scolding us, telling that you're not fit to be a doctor at all. There are many things. We have had days when nursing staff would insult us very badly for doing something wrong. But yeah, at the end of the day, we feel bad, but this happens to everyone in the course. You have to make mistakes and then you have to learn. And nobody wishes bad for you. That's the thing that I think. Nobody in the hospital ever scolded you or criticized you. They don't wish bad for you. You have to extract the good from it, extract whatever is useful to you. Someone has criticized you for not being able to insert a cannula. It's okay. Many times, even proficient nursing staff wouldn't be able to insert a cannula into a dehydrated patient, dehydrated baby. So that happens to everyone. And failures are stepping stones for success. So you make mistakes and then you learn. You don't diagnose things, you don't write the case sheet properly, then you learn how to actually put it. And never in life will you make the mistake again. The very small things like I was in government hospital, the investigations, in our hospital, the investigations are free if you have Aadhaar card, the ration card. So we are in liberty to give as much investigations as we want to. And I was once giving urine test to a patient and I just wrote urine protein, which was so silly of me because if we are suspecting any kind of UTI or anything in him, I could have actually sent urine microscopy and urine culture and sensitivity also with the same sample, because it's very difficult for illiterate, uneducated people to again go here and there to get the tests done. So from that time, I made sure that every time I send the urine test, I also send microscopy and culture and sensitivity. It's very simple. It's the basic thing, but that's how interns actually learn. We make mistakes and then learn. And many times even co-interns, we would have had pity fights for the sake of schedules, duty rosters. People even on hours of duty because it's so hectic. If you're doing the labor duty or if you're doing a medicine casualty duty, even 1 hour of extra duty would drain all the energy from you. And that's how pity fights happen. But then during work, we are all together. So that's how I think we have to overcome everything, every kind of criticism and move forward. Just move on.
Right. Dr. Deepti?
I've understood that you should not take criticism too personally. scolding the intern. They are not scolding Deepti in particular. If it was anyone else in my place, also they would have done the same thing. Understanding that they don't have a personal vendetta or grudge against you is very important, because otherwise you'll start thinking everyone is unfair and piling up upon me. Just understanding that it's criticism is not personal is important. And second thing, I would instead of waiting for yourself to make all the mistakes and learn, it's good to watch around, see what people are getting scolded for, and learn a little bit from that, along with your own scoldings, of course. With them also you can learn. That is one thing I felt. And I feel with for anything you should ask, otherwise the answer is always no. Whether it's a new procedure you want to do, just ask them, can I do this? Because what's the worst they can do is say no. But what if they say yes and you get to do something really cool? So learning to ask, like, can I do this, is very important.
That is something Dr. Anuradha had told me last time as well. We had a chat. She was like, you need to learn to, ask people
Oh,
with
and you
a
need to
experience.
put yourself out there, because if you're not around and if you're not willing and you're not actively participating, nobody is going to come and push you to get that chance. You have to ask and you have to advocate for yourself.
Right. That was very nicely put across. So
Yeah,
I'll
I think we have to just go and grab opportunities wherever we get. If someone asks you, will you give this conversation? You should not say that, no, I do not know how to give. You should not have a second thought. Just go say, yeah, I would love to do it, but I need under your guidance, whoever is there. So I think that's where you have to go on. Then only then you will learn. Or else you would just, be somewhere else. And you go where the April, where the government start conducting a normal delivery, even if it's the first day of your posting in labor. That's how you learn. Just go for it.